Question 21. A 75 years old man suddenly develops left leg weakness, urinary incontinence, and behavioral changes. Arm strength is normal. Which artery is most likely occluded? A. Right MCA. B. Left MCA. C. ACA. Right. D. PCA. E. Basilar artery. If it is leg weakness, urinary complaints and behavioral changes, so it is right MCA. But let's see. Oh, sorry, it's right ACA. Option number C, anterior cerebral artery strokes primarily affects the contralateral leg with frontal lobe dysfunction, causing personality changes and urinary incontinence. Question 22. A 28 years old woman presents with severe headache, seizures, and papilloedema. She recently started the oral contraceptive pill. Which diagnosis is most likely? A. Migraine. B. Cerebral venous sinus thrombosis. C. Meningitis. D. Subarachnoid hemorrhage. E. Brain abscess. I think it's B. Cerebral venous sinus thrombosis, but let's see. Yes, it's correct. Cerebral venous sinus thrombosis. It should be suspected in young women with headache, seizures, papilloedema, and risk factors such as oral contraceptive use or pregnancy. 23. A patient develops sudden ptosis, a dilated pupil, and the eye is down and out. Which cranial nerve is affected? If it is down and out, so it is oculomotor, cranial nerve 3. But let's see. Yes, a complete Turner palsy causes ptosis, mydriasis, and the eye deviates down and out. A painful pupil involving cranial nerve 3 palsy suggests a posterior communicating artery aneurysm until proven otherwise. Question 24. A patient with weakness of both legs after trauma. MRI shows compression of anterior spinal artery. Which sensation is usually preserved? Pain, temperature, vibration, and proprioception. D. Light touch. E. Motor function. I think it's C. Vibration and proprioception. But let's see. Yes, anterior cord syndrome causes loss of motor function and pain temperature sensation while preserving the posterior column function, vibration and proprioception. Question 25. A patient with repeated brief episodes of unilateral facial pain triggered by brushing his teeth. Most likely diagnosis is A. Bell's palsy. B. Cluster headache. C. Trigeminal neuralgia. D. Migraine. E. Temporal arthritis. It's trigeminal neuralgia, but let's see. Explanation: trigeminal neuralgia causes severe electric shock-like facial pain triggered by touching the face, chewing, or brushing teeth. Question 26. A patient with sudden severe vertigo, vomiting, horizontal nystagmus, and inability to walk. Examination reveals ipsilateral limb ataxia. Which diagnosis is most likely? A. Vestibular neuritis. B. Cerebral stroke. C. Benign positional vertigo. D. labyrinthitis. E. Meniere's disease. It's benign positional vertigo. Yes, it's maybe benign positional vertigo. But let's see. Oh, sorry, it's cerebral stroke. Acute severe vertigo with marked ataxia and inability to walk should be considered a cerebral stroke until proven otherwise. So its correct is B, cerebellar stroke. A patient with bacterial meningitis suddenly develops unequal pupils and deteriorating consciousness. The most likely cause is A. Hydrocephalus, B. Brain herniation, C. Migraine, D. Sinusitis, E. Hypoglycemia. It may be hydrocephalus or brain herniation, but mostly it is A. But let's see. Or B. Unequal pupils with reduced consciousness indicates possible transtentorial herniation in neurological emergency. Question 28. A 35 years old develops ascending paralysis 2 weeks after the diarrhea. Which organism is most commonly associated? A. Salmonella, B. Campylobacter jejuni, C. E. coli, D. Shigella, E. Vibrio cholera. So it's B. Campylobacter jejuni. Explanation. Campylobacter jejuni is the commonest infection trigger of Bulgarian bear syndrome through autoimmune molecular mimicry. Question 29. A patient develops diplopia that worsens throughout the day and improves after the rest. Pupils are normal. Most likely diagnosis is A. Multiple sclerosis, B. Myasthenia gravis, C. Botulism, D. Brainstem stroke, E. Lambert-Eaton syndrome. So it may be myasthenia gravis, but let's see. Yes, myasthenia gravis, fatiguable weakness of affecting the extraocular muscle with the normal people is characteristics of myasthenia gravis. Question 13. A patient suddenly develops complete paralysis but remains conscious and communicates only by vertical eye movements. Which diagnosis is most likely? A. Bulgarian bear syndrome, B. Locked-in syndrome, C. Myasthenia crisis, D. Brain death, E. Catatonia. It's C, but let's see. Oh, sorry, it's the locked-in syndrome. It results from vertebral pontine damage, most commonly due to basilar artery occlusion. Patients are conscious but quadriplegic and usually communicates with vertical eye movements and blinking. High-yield Mrcem tips. ACA stroke is equal to leg weakness plus behavioral changes plus urinary incontinence. MCA stroke face and arm weakness greater than leg aphasia, dominant hemisphere or neglect the non-dominant hemisphere. PCA contralateral homonymous hemianopia, basilar artery occlusion, locked-in syndrome. Cranial nerve pre-palsy plus dilated pupil, suspect posterior communicating artery aneurysm. Cerebellar stroke, severe vertigo with inability to walk is equal to stroke until proven otherwise. GBS, watch respiratory function with serial FVC measurements. Myasthenia gravis, fatiguable weakness with normal pupils. CVST, headache plus seizures plus papilledema in a young woman with risk factors. Trigeminal neuralgia, brief electric shock like facial pain triggered by touch. Thank you.